Hi, I'm Barclay Payne, Executive Director of the AMA Foundation, and with me are Emily Demko, our Program Manager, and Sandy Smith, our Director of Advancement. We are so grateful that you are interested in learning more about how you can become a Foundation volunteer. For the next 15 minutes or so, we'll provide you with an overview for each of these opportunities. But before doing that, we'd like to share a video that highlights why we do what we do.
The ongoing COVID-19 pandemic has changed our lives. But what hasn't changed is the AMA Foundation's commitment to improving our nation's health. Since 1950, we have provided more than $120 million in scholarships and grant funding, all made possible by our incredible donors. This past year, our foundation awarded nearly $1 million to support medical education and leadership and free health clinics.
Thank you so much for your generous support. It all is making a huge impact and making a difference in the lives of patients.
How did this $1 million improve our nation's health? Through our 11 physician-led clinics, nearly 22,000 individuals from our most vulnerable patient populations were screened and educated in prevention and/or management of type 2 diabetes and hypertension. These clinic programs include lifestyle coaching classes, community gardening, healthy cooking classes, and fitness classes in as many as 7 different languages. We're also a co-sponsor with the AMA on the Release the Pressure campaign, a collaboration with Essence Magazine, which is empowering Black women to develop a wellness plan to improve heart health and be part of a national movement for healthy blood pressure, the leading risk factor for heart attack and stroke.
The AMA Foundation supports the idea of health equity and doesn't just use it as a term to be thrown around, and it's something that they live and breathe.
We've continued our long-standing tradition of supporting physicians of tomorrow, awarding 28 medical scholarships, bringing our lifetime investment in future physicians to nearly $70 million. Our Leadership Development Institute provides a full year of training and professional development, which includes formal mentorships. Last year, when the Hahnemann University Hospital closed, the foundation donated $20,000 to their Displaced Resident Fund. Moving forward, in partnership with the AMA's Center for Health Equity and Improving Health Outcomes, the foundation granted $100,000 to support the expansion of Target BP on the west side of Chicago, which experiences a life expectancy gap of up to 16 years compared to Chicago's downtown neighborhoods. The foundation is launching an innovative LGBTQ fellowship program, led by C-SPAN co-founder and philanthropist John D. Evans. The foundation funded a pilot fellowship with the Icahn School of Medicine at Mount Sinai that will help to propel this transformative national initiative.
I think the AMA Foundation is really coupling to the issues that are facing physicians. We're investing in taking care of some of the most vulnerable patient populations, and just seeing that is very inspiring.
There are many ways to get involved and give back as a community. Visit the Foundation's website at www.amafoundation.org to learn more about our programs and make your tax-deductible gift online. Or, if you prefer, you can email AMA Foundation at ama-assn.org, and a member of our team will be happy to work with you and answer any questions you may have. To our loyal friends and donors, thank you so much for your continued generous support. We look forward to making more new friends and donors in the days ahead. Indeed, now is the time to give back and pay it forward.
There are several ways you can get involved. Serve as a member of our board of directors, serve on one of our committees, review applications for scholarship or grant funding, serve as a mentor, or serve as an AMA Foundation champion. We could not bring together physicians and communities to improve our nation's health without our valued volunteers, especially our board of directors, who, per our bylaws, can have between 16 and 21 members. They have the principal responsibility for fulfilling our mission and the legal accountability for operations. In addition to setting the mission, the board develops our strategic plan and oversees its success. As a 501c3 IRS designated organization, the foundation does not pay taxes. Therefore, the AMA Foundation Board owes its duty to the public rather than to AMA members and must practice loyalty, care, and obedience when acting on behalf of the AMA Foundation. Foundation board members are eligible to serve up to three-year terms for a total of 9 years. The terms of service reflects the foundation's fiscal year, which runs from July 1st through June 30th. The foundation meets 3 times per year, and board meetings are 1 to 2 days in length. 2 board meetings are held at the AMA headquarters in Chicago, and 1 is held virtually via Zoom. Each board member serves on 1 or 2 committees, which generally meet quarterly and are mostly facilitated online via Zoom. These meetings are approximately 1 hour in length. Board members also represent the AMA Foundation outside the boardroom as ambassadors. This can include talking with colleagues and friends about the good work of the foundation and serving as a link between the AMA and its members, donors, prospects, and friends. Educating and stewarding these important stakeholders about the importance of the foundation's work is critical to our success. And because board members' engagement is critically important to the foundation's charitable work, board members are asked to set leadership examples in the following ways: make the foundation one of their top philanthropic priorities, make an annual gift of at least $1,000, and consider making a planned gift to the foundation. In addition to personal financial support, board members are also expected to participate in activities related to fundraising. This includes anything from identifying potential corporate partners or individual donors, to hosting events, to sending thank you notes, to involvement in strategic solicitation. Next, I want to share an overview of the volunteer opportunities in serving on one of our committees. We have 5 AMA Foundation committees that would welcome the volunteer support of those interested in serving. Here's a snapshot of those committees and their focus. You may choose to serve on the Audit, Corporate Development, Finance, or Program Committee. Again, these committees generally meet quarterly and are primarily facilitated via Zoom, and each committee meeting is approximately 1 hour in length. Serving on a committee is a great way to learn more about the workings of the foundation and can be a great orientation pathway to serving on the board of directors. Now let's hear from Emily on 2 additional volunteer opportunities. Emily, take it away.
Thanks, Barkley. Volunteering as an application reviewer is a great way to get involved with the foundation. Serving as a reviewer for our scholarship program, community health program, or our Excellence in Medicine Awards program allows volunteers to learn about the incredible drive and commitment of today's as well as tomorrow's physicians. Our review process is completely online through SurveyMonkey Apply, and each year we offer a brief new reviewer orientation to familiarize everyone with the online system. In addition to that orientation, we offer staff support for any troubleshooting or questions you may have throughout the process. Reviewers are typically assigned 10 to 15 applications to review and are given approximately 4 weeks to complete those reviews through the system. The total time commitment depends on how many applications are assigned, but the expectation is between 10 to 20 hours total. Reviewers rate all applications on a scale from 1 to 10, with 10 being the highest, according to a provided rubric. Reviewers are also able to add comments and notes to each application review. Once all reviews are submitted, the top scored applications are moved to a second round of reviews if needed. Categories with less applications typically need just 1 round of reviews. Reviewers for each category confirm the suggested recipients based on the top numerical scores. Conference calls are held if further discussion is needed. Once reviews across all scholarship or award categories are complete, the program committee of the board gives final approval to the suggested final recipients. Once approval is unanimous among the committee, recipients are notified as well as those who did not receive funding. In addition to completing assigned reviews on time, reviewers are expected to view implicit bias training videos and to be willing to participate in a selection conference call if needed. The second volunteer opportunity in our programs area is our Leadership Development Institute, which provides training and networking opportunities to a cohort of final year medical students. Now in its 3rd year, These 10 to 12 students participate in communications workshops, monthly webinars, and discussions on tools, resources, and tips to succeed as they transition into residency. As part of the program, these students are also paired with a physician mentor. Volunteering as a mentor is an important and beneficial way to interact with and support these extraordinary young leaders. Mentors are matched with LDI participants by the foundation staff based on specialty or career goals similar to the assigned physician. Mentors are provided with introductions, as well as monthly reminders and resources to strengthen the mentor-mentee relationship. Volunteer mentors are expected to connect with their mentees at least once a month over a 12-month period, connecting via phone, email, or Zoom. Mentors should expect to be open as a resource to their mentee for networking, advice, and possible shadowing opportunities if and when available and appropriate. Mentors must be members of the House of Delegates and attend the AMA annual meeting to connect with their assigned mentee, and ideally, allow the mentee to shadow them when appropriate during the week at annual. Now I'd like to invite Sandy to share with you some details on our AMA Foundation Champions program.
Thank you, Emily. The AMA Foundation's Champion Program was formally launched last year at the AMA November special meeting with a group of 50 delegates. The Champions played a vital role in the fundraising success of the foundation by providing prepared remarks during section, council, and other virtual meetings, as well as delivering fundraising progress updates throughout the meeting via WhatsApp and GroupMe. The Champions were essential in leveraging these platforms to help disseminate information in a peer-to-peer environment. Based on the immediate success and feedback at the November special meeting, we are eager to continue expanding this group of close friends and supporters within the AMA House of Delegates. As a foundation champion, you can expect to be the first to know about exciting foundation announcements, such as the launch of new programs like the National Fellowship for LGBTQ Health and invitations to special events, such as the Excellence in Medicine Awards and donor receptions. Serving as a foundation champion requires a minimal time commitment, and there's no formal term of service. We simply ask our champions to engage and leverage their networks and connections to help raise awareness, friends, and funds for the foundation. Here are some examples of ways to serve as a champion. Invite colleagues to join you at a virtual foundation event. Forward a foundation e-newsletter and press releases to friends and colleagues to share our programmatic impact. Share foundation posted updates and news via Facebook and Instagram pages. Share updates at section, council, and other group meetings during the House of Delegates meetings, and more.
Thank you, Sandy and Emily. And again, thank you for your interest in the AMA Foundation and in becoming a volunteer. Clearly, we have some great opportunities for you to get involved in advancing our mission. If you have questions or need more information, please reach out to us. Our contact information is listed on the screen. If you've yet to complete our volunteer candidate form, please request this form from Chris Seitz. Chris's contact information is also located on the screen. Working together and with your support, the AMA Foundation will bring more physicians and communities together to improve our nation's health.